Just some pictures of my mom.
When the pandemic hit, Janet Foley's 83-year-old mother, Marilyn, was living in this retirement home. To visit, Janet was first required to take a COVID-19 rapid test.
I was an essential caregiver, so I had to be tested all the time. If you pass that test, then you can go in.
Begin by opening the pouch and removing the test device.
The retirement home's tests were from a Canadian company called BTNX. Ottawa spent about $2 billion to buy 400 million BTNX tests in those now familiar green boxes. But these rapid tests may not have worked as well as advertised.
So it looks like the data was manipulated for it to be more sensitive.
We asked several infectious disease specialists to review BTNX's clinical studies presented to Health Canada for approval. BTNX claimed its at-home rapid tests could detect COVID-19 more than 90% of the time, well above the World Health Organization's minimum threshold of 80%. But the scientists consulted by Global News found irregularities in those results. BTNX is based near Toronto, but its tests are made by a company in China. Global News found BTNX had removed dozens of samples from the test's original clinical study without explanation. That omission made the test appear more sensitive.
That removal of data is really a violation of all research principles.
BTNX said it deleted the data because the U.S. FDA was moving towards excluding retrospective positive samples, which BTNX did as well. But the FDA didn't change its guidelines until 1 year later, and experts said that explanation isn't convincing.
It's a complete data set that they changed. That's why it was strange.
This biomedical researcher conducted a study for Spain's health system. She recommended against buying the test, finding it was among the worst at detecting COVID-19 in asymptomatic patients.
In this case, was among the lowest sensitivity of what we test.
In the fall of 2020, Health Canada conducted its own study, and it found the BTNX rapid test was 100% effective at detecting COVID-19 in patients with the very highest viral loads, like the super spreaders. But in other infectious patients, the test sensitivity plummeted, far below what the company had claimed. Other studies by the British and German governments found similar, even lower results. Experts say this means a positive test result could be trusted, but not a negative one.
Typically, we would say that's unacceptable and deem that the test is not good enough to be able to let us know that an individual is actually infectious.
In response, BTNX accused Global News of cherry-picking data. It said the Canadian and German health ministries used poor samples which did not accurately represent test efficacy, though regulators around the world were using the same method. BTNX provided results from several private studies showing higher sensitivity levels, conducted in countries such as Pakistan and Mexico, but it declined to share the raw data.
Remove the swab.
In February 2021, Health Canada approved the BTNX test. If used properly, the instructions said the tests were more than 90% effective.
I think it's outrageous that the public wasn't as aware of the discrepancies in the testings that had real-life implications.
Health Canada said it had no plans to reassess the BTNX device. A spokesperson said all authorized tests are supported by scientific evidence demonstrating that they consistently met standards to provide accurate and reliable results. Janet Foley feels her trust in the rapid tests was betrayed. In 2022, Foley's mother, Marilyn, died of COVID-19. It's unclear how the virus entered her nursing home. Her last moments with her mom were spent in full PPE, holding her hand through a glove.
It's unconscionable.
Jeff Semple, Global News, Toronto.